So initially, when I had actually semi-retired from school, I was having problems with I guess at that point I was having problems with my arms. And Tim and I were getting ready to go on vacation, and he looked at my chest and he goes, "Wow, one of your bones is sticking up further than the other." And I kind of got to looking. It's not something I kind of get in the mirror and kind of like look and see like where I'm at, and he goes, "Oh, you're really like swollen, and you need to immediately go to the doctor before we go on vacation." I'm like, "Okay." So I made a doctor's appointment, went in, and the doctor said, "Well, I'm not really sure, maybe it's your thyroid, maybe you have a growth or something underneath there. We need to send you for a full chest x-ray." So I said, "Okay." I went in for a full chest x-ray, and the clinic that I went to, actually the hospital is directly across the street, so I could walk over there. And the gentleman that was doing the x-ray said, "This isn't going to show him anything." I said, "Well, can we call them?" And he said, "We can call them." He said, "But I don't know if they'll answer the phone." It was that particular day was Halloween. I was the last person to be seen in there, and they were actually decorating for it was the day before Halloween. So in Madras, they do a big, the businesses all decorate, and all the staff gets in costumes, and they have like a little competition. So they were getting ready for that. So needless to say, nobody did answer the phone. So I said, "Okay, let's go ahead and do the chest x-ray. That's what they said I needed. Let's just do it." So I did it, and then, I don't know, maybe I went in a week later or something, and they said, "Oh yeah, the x-ray showed nothing." Said, "Okay." So they said, "Well, the next thing we need to do is we need to do an MRI." Made an appointment, went in, got the MRI. So I talked to the gentleman before I was doing the MRI, and I said, "Okay, so like, I've never had an MRI before. I've actually never really been to the doctor very much, annual physicals and that type of thing. But I'd never really had anything wrong with me, or I felt that was wrong with me." So, so I said, "So like, what are we doing, and how does this work, and what kinds of?" He goes, "Well, really, it's a fishing expedition. They don't really know what's wrong." And I said, "Okay, like, so in the end," he said, "It's up to you. Do you want to do it or not?" And I said, "Okay, let's do it. This is what they said I needed to do. Let's figure this thing out." And in the interim, I was getting to where I couldn't hardly move my neck. It was like driving. It was like I'd have to like move my whole body in order to. I probably wasn't that safe on the road. Did the MRI, and when it was all done, he kind of showed me, this shows inflammation. This shows, basically he could show me that I had inflammation, and that was all. He said, I'm not the doctor. I can't really tell you this, but, here we have these different colors, and this indicates this. And so I went back into the doctor, and they said, "Well, really, this is inconclusive. We know you have inflammation." And I know, you could tell I have inflammation. I mean, it didn't take, MRI to show that. So then the next thing that they sent me to was they sent me to High Desert Orthopedics over in Bend, because they said, well, maybe it was, something with your bones, or maybe this or that. At this point now, I'm sure I'm stressed, so they have me on anti-inflammatories. I'm now on a second blood pressure medicine, and for years I've been on one blood pressure medicine. And so I went to the orthopedic doctor, and I walk in, and he's got this little laptop, and he says, "I've looked at all your charts, I've looked at everything." He kind of looks at me, and he says, "You have arthritis." And I said, "Oh." And at this point, I can't move my arms hardly. I'm stiff in the neck. And he goes, "Yeah, that's your symptoms." And I said, "Okay." And he said, "So do you want an anti-inflammatory?" I said, "Well, they've already given me one." And that was the end. I wasn't there. I didn't need more treatment. I didn't need anything. This was just your diagnosis, and this is kind of what you have. And I was like, "Okay." So I left, and a little bit relieved, because the doctor, prior to going to High Desert Orthopedic, said, "Oh, they're probably going to take a needle and draw out some of that fluid and then analyze that." So the whole way there, I'm thinking of this big needle going in. So a little bit relieved when he just said he didn't have the needle. But so I went home, and I don't know, a couple of weeks or something.
At least.
And I thought, I don't have arthritis. And a lady that I'd worked with, Stephanie Garber, she thinks Dr. Hanes is wonderful. And so I thought, I'm going to go to him because I honestly don't think that I have arthritis, and I think that there are other things going on, and I want to get to what that is, what the root of that is. So that's when I started going, and it was just about a year ago. And I came over, and he said I had a pigeon breast, and I couldn't move my arms. And through several visits, we worked on my arm movement. We did, he adjusted me. We worked on my arms. We did laser.
Diet.
And changed diet. And yeah, I'm very happy. Yeah, I can actually move my arms. I don't have to think about it. It would be when I first started, I would like barely get my arms up, and I'd ask my husband, "Can you take my shirt off?" I mean, it would be. I was.
She literally got to where she couldn't raise her hands above her shoulders. She was so frozen that she only had movement to about here.
Yeah.
So,
All right.
in 1 year, she's come a long ways.
1 second. I just like to do a quick little check as we're rolling. Just make sure things are good. So Tim, same question to you. What brought you in here?
Well, my wife brought me in here. So after she had had some success with the doctor and met the doctor, she said, "You really should give this a fair chance and try this once." And I said, "Well, there's nothing wrong with me. I'm perfect, you know." And I walk like I'm 90 and everything hurts. And I could make a list of different things that have been, I've been to doctors for over the years. One of them was Raynaud syndrome, which is a circulation problem with the tips of my fingers. I've had it for 25 or 30 years. I'm an ex-smoker, and perhaps it traces back to those times. But every morning in the 6 months of the year in the wintertime, my fingertips when I'd wake would be just solid white, look like dead flesh, no circulation. I would literally have to get them in warm water and warm them up to get going. And we talked about, when I first met the doctor, and we talked about some of the problems I was having, and I had kind of a neuropathy problem with my 3 little toes on my right foot, going numb, couldn't understand why. And he was the first one that ever discussed with me in any way that diet might affect some of these things. And sure enough, my autoimmune system has some markers that indicate it's turned on and will be turned on for my lifetime. I had no idea of any of these issues. And the nice thing about the issues was there is recourse for it. And now it's just been a year. My fingertips hardly bother me. I can't say it's 100% gone, but they're over 95% better. We're working on it. They're getting better as we talk. It's only been 1 year. I've been 30 years with this problem. I feel it's great. I've gone leaps and bounds. Same with my right foot and the neuropathy. I have no numb feeling in my toes whatsoever. Still maybe have a weakness in that leg somewhat, but I've injured it once. The doctor has also taken time to work on my right calf, which I had torn the muscle in a few years ago and had basically kind of atrophied. One leg was still strong and one was not. We've done quite a lot of work on the scar tissue that was built up in that leg muscle, and it is also at least 90% better. We're still working on it some. I went from being nearly crippled and limping and having bad cramps in my right leg to coming on top of that problem, and just recently went on a goat hunt with my wife to Hell's Canyon, was able to hike down there and get her goat and carry it back up to the hill. And to me, that was a real worry. At 62, I was feeling like my legs might be gone. And if your right leg's gone, both legs are gone, because you're not going to get anywhere. And I have really faith that, no, my life, I'm not physically degenerating that fast, that diet has really been a major contributing factor to some of my problems, and I wasn't aware of that. Also, through some tests, blood tests we've done here and whatnot, I was made aware of. Pre-diabetes is creeping up in my sphere in my life, and we've taken some positive steps to change my diet and my exercise and to pay attention to my glucose and my carbohydrates. What I'm taking in for carbs is really, I was unaware of how much it was affecting my blood sugar, and was really unaware to even the fact that I might have higher blood sugar than I should. All these things have been good for me. I've, in the short 9 months we've been working on my problems, I've lost weight. I have very little trouble with my fingertips. My foot is a lot better. My calf is a lot better. I could go on for hours. I've really had some positive experiences, but also I'm a skeptic. So when I came in the door, I'm undoubtedly one of the biggest skeptics the doctor gets to see, and I literally say, okay, fine, show me. You know, I gotta be from the show me tribe, and I don't want you to just tell me. I need you to like back it up with something. The doctor's very good at the analysis side of things and showing me other things that can indicate what he's tells me, and then he can back it up with tests and test results and things that I see as a solid scientific background. It has really been very good. Some methods, I would say, were new and novel for me, and had somebody describe them, I might have had a smile on my face, but does not matter. I am a results person. The doctor's got results with me. So however you want to look at that, being very skeptical, he has convinced me that the functional medicine side of things was something I had never considered. If I had anything wrong, I went to the doctor and said, give me an antibiotic. And I have learned a whole lot that there's another way to take care of things, and perhaps the simple steps that I thought were simple in the medical world were not all that they were cracked up to be.
Wow, that was awesome.
Do you want to share that you had Giardia twice, and we thought
Oh,
maybe
yeah.
that was what led to the leaky gut, and that was what turned on the autoimmunity? And
So in my career in the woods, Giardia wasn't really known in the water systems in the early 80s. We always drank out of the creeks and the springs and as loggers, and you might fill up your canteen in the creek and never think about it. All through Central Oregon, I trusted the water, clear, fine, flowing water. And beaver fever, Giardia has moved into the Northwest, and it has taken over even the best looking of spring water or anything is no longer safe to drink. In the process, I unfortunately got Giardia once bad working in timber in the cure that the doctors gave me maybe cured it, maybe just slowed it up, and I had it come back after a certain amount of time. It kind of crept back into my system. Then I had Giardia again. We were on a float trip in Idaho, and I got Giardia again in Idaho in some real pristine country in the Middle Fork of the Salmon River. But it's in all the country, and I consumed very little water. I think I brushed my teeth in the river. That's all it took. And I had it really seriously that time, so serious I needed to go pretty much to the emergency room. Almost, was debilitating to where I could only lay in a fetal position, and it hurt so bad. It was serious Giardia. They also put me on an antibiotic at that time again, and that's been a few years. When I saw the doctor, we discussed this, and he said, well, that could really damage your stomach. You could have some problems with your stomach due to this, and there is some other cures for it to be a parasite that you're still carrying in your system, and let's put you on that. And it really had a marked effect on me, and I had no idea that the wormwood that he put me on would really make such a difference, but it did. And we went through a protocol and it really seemed to be the start of my stomach and my system getting to be better.
Kind of healing that leaky gut.
Yeah, and I didn't even really understand what a leaky gut was, so that was a learning process at the time. But perhaps my gut was extra leaky because of the Giardia parasite that I had been carrying for 10 or 15 years at least, perhaps even longer.
Yeah, that sounds rough. I've heard nightmares about beaver fever.
It's not a good thing to run into. Don't drink the water anywhere in the United States unless it's purified. I don't care how good that source looks. Do not drink it.
Do not drink it.
I actually got Giardia about 6 months ago. Drinking bad water. So I've been working in Warm Springs, and they're on the boil water notice. And I don't know if that's where I got it. I don't know where I got it. But we learned of other alternatives than antibiotics or flagyl or whatever that you can take. So there were other kinds of supplements that actually eliminated my symptoms, which we're very, very glad to have that. Yeah.
I could imagine.
Yeah.
So what initially made you guys come and seek care with Dr. Hanes? Was it somebody told you about it? Was it just your own research? What was that push?
Initially, I worked with a lady, Stephanie Garber, who
Mhm.
was actually the superintendent at our school. And she highly recommends him. I had not only heard her story, but I'd heard other stories of folks that had came here and got treatment. And so it was in the forefront. So when I was looking at what I would call alternative choices of what to do, and looking at something that would be maybe non-medical, because I feel like the medical teams out there had really said, okay, here, you have arthritis, that's it. You know, you're in this cubby hole, and that's the cubby hole that you're in, and that's just how you're gonna live. So I needed to find another alternative to treatment, or to figure out what was really gonna work for me, and what did I need to do to change that, because I didn't believe I was in that cubby hole.
So what about you, Tim? Did you just hear it from your lovely wife and
Well-
decided to give it a try?
I'm a results-based person, and I'm, as I've said before, skeptical. I'm sorry, but that's just my nature. And so I was probably a little harder to come in than most, but I really noticed the strides that Jamie made and the gains, and actually they were quite rapid. And so every time she would come to the doctor once a week and they would work on her problem, she would be markedly better. And so I'm a results-based person. And pretty soon I looked at the results and went, yeah, you know, that's not too bad. And I'd had some trouble with my neck, and I had some real uncomfortable spots in my body, and I thought, you know, I bet he could probably help me with some of that, and I'll give him a chance. And if he can't, well, I'll just throw him out on the street, and I'll just go back to my old ways, you know, but I'll give him a test run once. And we're still on that test run. And, you know, so far I haven't had ever a day that I wanted to throw him out on the street. Actually, I recommend him nearly daily to people I run into everywhere. Will say, oh, I have a balance problem. A fellow this morning said I had brain surgery in Madras, and I was talking to him, and I said, I can't recommend strong enough. You should just go into the office and just talk to Dr. Hanes for a few minutes. You would be very wise to take some of his. He's very good with balance and a lot of issues. And the one thing I think, I've been to a lot of chiropractors, being a timber faller in the woods, back issues over the years, and this isn't the first stop in different chiropractic offices, but I've never been in an office that was like this. Dr. Hanes works Monday, Wednesday, and Friday, and still comes in Tuesday and Thursday to study. So he can look at my case, and he has the time to go through what I need. And he really, I felt like he went above and beyond, and he goes above and beyond in the care, and how much time he gives each patient is incredible. Anywhere else I ever went in, they said, oh, Tim's here, time to give him a treatment for his neck or his back or whatever, and time to be sure he gets a bill and get him out the door, and the next one's here. And that's as far as they really cared. Scheduling, you know, get a schedule, we'll do the physical, and, you know, the physical work on him, and we'll send him back out the door. But there's so much more involved in Dr. Hanes' style. And at first I wasn't sure I was gonna like that, but actually come to find out it's what makes this office work and makes it stand above and beyond. I'm just thinking that it's for Jamie and I, it has been a godsend. Last year at this time, we were going hunting, and she had her gun. She could not raise her gun to her shoulder. She could only get it up this far. This year, she could hold it over her head and jog. I mean, it's a huge, huge transformation. And it's hard to come into any office and say, I had this or that problem, and they cured me. Granted, we've talked this over. If I fall and break my leg, I'm going to go to the emergency room and have them set it. But almost any other problem I have, I had a sty last month in my eye. Had one maybe once or twice before in my eye. It was a nasty sty. It happened to be a particularly bad one. Rather than just go to the medical doctor now, which I always would have done before, or even the eye doctor, and I know they would just give me an antibiotic for it, I came here to Dr. Hanes to ask if there was anything that he knew we could do without giving me an antibiotic. Because my stomach has come a long ways from where it was, and I really don't want to take antibiotics. If you have to, you have to. But I was hoping I didn't have to. Sure enough, Dr. Hanes has got I don't want to call it a miracle cure, because that's being joking. That's not the point. He has a program. He put me right to it on my eye. It involved a couple of things we put in my eye, and putting some hot packs on my eye, but we also did a laser treatment on my eye. I was amazed. I'd never had a laser treatment before. Fantastic. Really helped my sty problem. I tried to beat it for a week or so on my own. In 4 or 5 days, he had me pretty well straightened out on the road to nearly being gone, or didn't bother me, wasn't painful anymore. Really helped out, and it's gone, healed perfectly without an antibiotic. So this is something, I would say, just a learning process for me. A lot of what I've done in this office is learn. I've never learned anything in a doctor's office or a chiropractor's office before. Never. So that's probably what I like, one of the things I like for it.
I had never been to a chiropractor before because I didn't really know what they did, and I really thought, no. And so this is the first time I'd ever been adjusted, and actually I would recommend it to everybody. I think I will be adjusted once a month, till I die. But at first I was like, I'm not really sure what those chiropractors are.
The bone crackers of the world. Oh my goodness. So, Jamie, when you first came here to see Dr. Hanes, did you have any expectations?
The expectations I had when I came, no, I didn't walk in with, I guess I had hope, would be the expectation, to hope that there was something, because I basically had just been told that this is the way your life is. And honestly, I was having heart problems sleeping. I sleep either on my side or my stomach, and now I had to resort to sleeping on my back because it would hurt my arms. They're just that my lifestyle had changed so much, and so I didn't have any expectation that I was going to, in a year be able to be back to my normal self. But I couldn't swim. I like to swim. All the things that I typically had done all my life, all of a sudden I wasn't doing. And so I didn't have any expectation that I was going to, boom, be able to do all of those things. But I had hope that somehow I was going to figure out how to maybe make changes or, some alternatives.
What about you, Tim? Did you have any expectations?
I think I was on the want side of things. To tell you the truth, when I first came in, I just came in for an adjustment on my neck and my back. And I've had, being a timber faller, lifelong timber faller, I've had issues with my neck and my back for years. And I can always use some work on my neck and my back. It's just been a little painful. And I thought I'll just start there and see. And I didn't really realize what all the doctor was capable of helping me with. And so as we got into a few discussions, then I found out there was so much that was available to me in this office that had been lifelong issues, like my Raynaud's, that I had basically just given up hope, and the doctor told me to take an aspirin. And so I took an aspirin a day, every day.
The medical doctor
The
told
medical doctors told me to take an aspirin for that, and it did help some, but it was no real answer to my problem. And so just issues like that we could talk about, and that there was other things I could do. And as we started doing some blood tests and different things on me, we started realizing that he could show me with actual scientific tests that I have faith in, not just come out and tell me, Tim, this is how it is. And this is important for me. My mom was a lab technician at the hospital in Bend forever. And so I was raised in a scientific-based family, and I understand those tests. And to me, for medical, or however you want to look at that, for me, I needed more from a doctor than just tell me, this is what's wrong with you, I'm telling you. I need some other things that are showing me that what he's telling me, that they go together and they make sense. And Dr. Hanes is very good at bringing those two sides of medicine together. And his functional medicine plan is a great thing. I didn't even know the word functional medicine before I walked in the door. So there was so much learning for me to get that after I learned a little bit, I would have issue after issue, and the doc would have a way to help me. And one of the biggest one was I had torn my right calf muscle, and we worked repeatedly on a scar tissue buildup I have in my right calf muscle. My leg was basically atrophying. Made remarkable distance on that. It's not 100% yet, but it's at least 90% better than it was. And we've been less than a year in this office. I've been less than 6 months working on that leg muscle. A few more treatments, it's getting better all the time.
What do you think, Jamie, about the functional medicine approach. Were you skeptical at first? Are you a believer of it now?
So the functional medicine approach, I didn't know what it was. My folks never went to the doctor very much. I mean, we went to the doctor if we were sick. So there's not, I didn't grow up in a medical family like Tim, and so I didn't have really any idea what that even meant. So I didn't, as I came here, then of course, what do? Get on, you Google this, you Google that, you kind of understand it. I look at it as more a holistic approach, kind of looking at the whole body, looking at all your systems, making sure they all work together, looking at where in your body that you can make improvements, and how do you make those improvements. So definitely a believer now. Realize that I think food is your medicine, or you kind of look to really, you're taking food in, what is it doing and how is it helping or hindering your body, and then really making sure all your systems are working together. Definitely a believer. I wasn't skeptical when I came in. I didn't really, it was just another alternative to getting help. But I did have faith because people that I knew and trusted and believed in had faith in him. So I didn't come in thinking, is this just some doctor out there? I came in with actually the knowledge that he has helped others. And I guess that's where I came in with the idea of hope. But I had no real expectations, or it was just really an unknown. Yeah, but yeah, truly a believer now. Yeah.
Get you turning people into believers, Dr.
Yeah.
Hanes. So I got a good question for you, Tim. I'm curious to know your answer on it. What do you think is the main difference between Dr. Hanes' approach and a standard medical doctor today? What have you noticed?
Day and night. So, when I go to the doctor, this is just my outlook, is the doctor knows a lot, and he's a very smart man, but he doesn't have time to share that with me.
So the medical doctor.
The medical doctor. And so he's rushed by his schedule and many other pressures that he has. And so he only has a limited amount of time to delve into my issues. And like I say, if I broke my arm, that's pretty straightforward. It's got an x-ray, it shows it's broken, he'll fix that up and send me out the door. But as far as telling me how I can keep my arm from being weak in the future or anything like that, not so much. And the doctor is good at helping me understand what my body is trying to tell me, and I'm going too fast or just too belligerent to stop and pay attention to what my body is telling me. And when he stops and points it out, and we've taken some blood tests and backs it up with, scientific points that I sure can't argue with, it makes a world of difference for me. I've never had the medical doctors do anything more than just tell me this is what I'm saying. And that's fine, but you can't take that very far. I can go home and research Raynaud's, but it doesn't tell me what I could do for it or what a possible cure is. And if they tell me that aspirin is the cure and you're gonna have to take an aspirin every time you have an issue with it, then that's what I think is the holy grail. And I've been doing this for many years, and my Raynaud's has just got, for example, my Raynaud's syndrome with my fingertips in the circulation, it just got worse and worse. And so the difference being the medical world has its side, but they don't take the time to change my thought process. And had I realized this when I first came in the door, I'd have probably been really hard to teach because I'm skeptical. And so I didn't even know it was coming. So I couldn't be skeptical of what was coming because I didn't really know. And he approached it in such a way as I never could get off the ground with my skepticism. He killed that. He has a way of showing me positively that this is what's going on, and I can't just go out there and go, you know what, he doesn't know anything. No, I can't, because he's also given me a ream of paper that this lab, and not just that, other things that he's told me that I can look into that just support what he's telling me. A lot of it's just common sense based. As soon as we discuss it, you go, well, of course, I don't even have to wonder about that. That just makes perfect sense. I know it from how I feel, and when I eat this or when I do that. All these things I had no idea that I might be pre-diabetic. In a few tests, we kind of got on top of that I might be pre-diabetic and I need to lose some weight. Thank God, due to the fact that we've changed my diet some through the functional medicine, I didn't have any trouble losing weight. I didn't have to go on a diet and do without. I joke every time I come in here how he's starving me to death, but really it's a joke. It's just different food. I enjoy it. I can still eat my meat. I don't eat potatoes like I used to, but I don't miss them. It's fine. We've adjusted.
Bread.
I can't have bread anymore, and that's been just an easy way to lose weight. I didn't realize that I was gluten intolerant. It's pretty easy to lose the gluten. I don't really need it. I wasn't too attached to it. All those things have just made me feel a lot better. I still have ways to go, but I don't think anyone is ever 100% on the physical side. We all have a little work we need to do.
Yeah, absolutely. Do you have any interjections in that?
I think what I want people to understand, and you guys get this, is yes, this is different in a chiropractic office, this is different in a medical office. How do you see, the analysis is different, right? So you come in here and you can go to a doctor and they may do some tests and they get the diagnosis right, but they only have two tools, drugs and surgery.
That's right.
And which works fine for acute, severe cases, you might need drugs or surgery. But if you don't understand how the gut and leaky gut and the micro and macronutrient deficiencies and the vitamin D deficiency, how that interplays with the gut and the immune system. And so if you guys could just touch on how, we've talked about the adjustments and how we figure, but how did the functional medicine side in finding out, I've got super high inflammation and I don't methylate my B vitamins, and taking care of that, the adjustments, working with an anti-inflammatory diet and resolving, we have all these plates spinning, and that's, I think, people come in, they don't even have a concept for that. They've never experienced it. So if you could talk about how we kind of pulled back the wool off of your eyes, and it's like, wow, not only is he adjusting me and doing laser, but he's showing me how these labs that no one else has ever even done, and how I can change my diet and lifestyle to correct that, and however you want to.
And this is a question you guys can both answer together.
Yeah.
Okay. So initially when I came in, one of the things that I guess was tested for was we found that in my gut I had candida yeast, and with that I needed to change my diet. I needed to reduce that yeast, and so that was kind of, I call that the foundation. And when I tell folks to come in and visit and see if this is an office that they would like, and I encourage people to do that, I kind of tell them that's the foundation. Initially you'll come in, there'll be a long assessment. He'll visit with you. He'll talk about your eyes or your hearing or your every part of your body to see how it is and how it's reacting with each other. But really a foundational piece will be, how is your diet? What is your, and most of us have candida yeast, or we have a buildup of candida yeast. Tim did not. He had something else, but that really you'll start with, I call it the foundational piece. And with that comes a change of diet and understanding how diet works. Once you do that, and it's not an overnight thing. Like I thought, when I came in and I kind of changed, and it's not that you're eating horribly, it's just that you're actually eating better and you're more aware of what you're eating. You're taking out the chips and the pop and the, all of the things that we tend to go to as little snacky things. So you're eating healthy, you're eating a healthy diet. And through the course of, maybe 8 to 12 weeks, that reduces and you get back on. So I was thinking, okay, it's like any other diet. You're on the Candida diet, and then all of a sudden, oh, you're better. So you're not on it. Well, really, it's a gradual lifestyle change. And as you learn, it becomes really your norm. And so really you now have eliminated these things, because when you do eat them now, they don't really make you feel that great. And so it's really that lifestyle change. So you've started that change of that foundation, your foundation. Then we actually, a little bit later, we got blood tests to see where exactly we were at, and what kind of markers are in our blood, and then what does that indicate. I had high inflammation, and so the inflammation reduced with my diet, but what other things is that blood test showing? And then we changed a few more things, and later we did another blood test to kind of make sure that what I was doing, and in a sense it kind of proves out that what you're doing makes you better. One of the things, I was on 2 blood pressure medicines, so I now am on 1. I also, quit taking anything for inflammation. And then it was kind of interesting. So I have to go in annually to renew my blood pressure medicine. And so they said, oh, we need, it's been a year, a couple years or something. We need to take your blood. And I said, oh, I just got my blood taken. And so the blood test that they take with the medical doctor is, I don't know, it almost reminds me of a check the box kind of thing. Oh, here's her blood. She's got this, it's these kind of levels. It kind of reminds me of the check the box. And then, so I had the blood test from here given to the medical doctor so that I could get my blood pressure medicine renewed. And it's much more thorough. It's very in-depth, and it's not a check the box. And maybe some boxes with the medical doctor, they would say, she's fine, or within range, so there's this range. She's within range, she's within range. Well, Dr. Hanes would say, yeah, not really within range. They would say that, but really you need to, maybe it's my vitamin D, or maybe it's, everybody tends to be low on vitamin D, and maybe they would say I'm within the range of vitamin D, and he'd go, yeah, look at this, really, if we start looking at this and how integral that vitamin D is in our systems, really you need to be monitoring that. Well, when I gave that to the medical doctor, it was maybe 2 days later, they immediately start calling me, and I'm at work, so they call me at home, and they leave a message. You need to get a hold of us immediately. You need to get a hold of us immediately. You need to get a hold of us immediately. So I call them, and I won't get this right, but my body doesn't methylate my vitamin B. And so they said, we need to make sure that you're doing something about that vitamin B. And we noticed in your lab tests, this is important. And I said, oh yes, we are already on it. I'm already doing that. Because immediately when Dr. Hanes had seen that, he said, this is what we need to be doing. But I thought it was interesting. Had I never had that test taken here, my medical doctor would have never known that. I've had, blood tests taken with the medical doctor, and I'm sure this isn't something that overnight just changed. So that was, I guess, another validation for me that I'm doing what I need to do in order to be as healthy as I can.
The fact that
that was the high homocysteine,
Mm-hmm.
and most physicians don't even order that test, but I order it routinely, and yours was really, really high, and that's why we went and did the genetic test.
Yeah.
And you see, what impressed me was the doctors, when she went in, said, we need to order a test. She said, let me bring you the results from Dr. Hanes' office. We just did some blood testing and see if that will help. She brought that in, and it only covered everything that they thought they were going to order on their test. It covered a world more, and it covered what they felt was important in depth. So I am saying that the testing that we got here was validated in a certain way by the medical doctors, and the fact that they just took those test results and were happy to look at them and trust those results were true and accurate. Well done. It wasn't a shoddy lab, it wasn't shoddy paperwork, everything was well done, enough that the medical doctors would gladly consider that as something that they could work off of also. Gave me faith that we're going down the right path, that there's another person that in their own way is validating what Dr. Hanes is telling me.
But the treatment approach is totally different.
Totally different.
Totally different.
But I have my
understanding
choice.
the leaky and understanding how a leaky gut. Now I watch people or I listen to people, you know, and maybe they'll have digestional issues or, you know, and I think, oh, they probably have a leaky gut. They're probably not understanding how, you know, that what those are causing, and it's probably causing, you know, more inflammation or causing problems within their system. And so I've actually taken the nutrition and how important it is. And I told you I'm working down in Warm Spring. Diet down there is horrible. And just within our office, there's about 10 gals that work in there in the office, and maybe 20 people work out in the field. But just that office, I've actually hired a lady to come in and give nutritional classes and teach and actually bring a healthy nutritional lunch once a month and teach these ladies how to read labels, what to read, you know, how they can change, how we can get rid of the little snacky baskets that they all have on their desk, and get something that's healthy in there, you know, kind of put up some challenges for them. Yeah.
And this is something I think that you've learned in the last year that we've been associated with this office. Dr. Hanes' office has opened your mind to the fact that not only do we need to change ourselves, but there's people that we work around and care for that we need to try and help educate them in any way we can.
Really like that. Look at you.
Yeah.
So,
That's-
so, I mean, I know you both said you would recommend people, obviously, to come here, but what would you say to somebody who's like, that's it, I'm gonna go see Dr. Hanes? How would you prepare them for this initial meeting with him?
It's pretty easy because Dr. Hanes is real thorough and he puts most people, I think, at ease. So if I was going to tell you, for example, you were interested, I would tell you that just to have an open mind. Go in and sit with the doctor. He'll take some time out of his busy schedule. You could just walk in the door and stand at, he'll come in a few minutes and he'll give you a few minutes of his time. And am quite certain that after you just speak with him for even a few minutes on the subject, that you will come back for in-depth, because he has a way of interesting your mind and engaging you, as well as not putting you in an uneasy situation.
What about you, Jamie? What would you prepare?
I would actually recommend doing an appointment, but because I'm a more structured person, but I would recommend doing an appointment. But I would say that you're going to come in, there's going to be, you know, a very thorough assessment. He's going to talk. He's going to put you at ease. You are compassionate. I know that you take an interest in every one of your patients. I think Tim and I we felt that you took an interest in us, and you felt like that you wanted to help us. But this is a small office. You know, you have that same compassion for all of your patients. And that a little bit keep an open mind, because it is that there will be things that will be talked about or procedures that probably are not typical of what, if you go into the doctor, there's not going to be your, 5 to 7 minutes of let's weigh you, let's take your blood pressure, how are you, let's get you up on the thing, let's listen to your heart, oh, you have the flu, out you go. It's going to be more of what's really happening with you. If you come in, I guess it's going to be more thorough. It's going to be more how are things working for you? Are you keeping up your exercises? If for some reason, like I had my arms, I was supposed to be doing different things, and so it's more wanting to make sure that you're making progress, and if you're not, then let's try some other alternative. But yeah, I have recommended people, and I have people that have come, and they're happy. I haven't had one person say, "Whoa, what were you thinking?" You know. So I would recommend anybody to come here.
So would you think, with Dr. Haynes' approach, I know he gives you the tools to understand why this is happening, but do you feel like he makes you hold yourself accountable to your progress? You feel like that's
That's an interesting question, because I was really surprised by that. The doctor would lay out this is the path you need to go on. Don't vary off it. Let's say eat these things. Let's not eat these things for, a period of time, and let's change our diet a little bit, for example. And I could always think that, well, when I go home, if I want to have a candy bar, the doctor doesn't know, or whatever. And so I would come back, and I would expect next time the doctor would say, well, Tim, did you cheat and eat carbohydrates? Did you do this? Something we discussed maybe. And he would never ask me that. And one day I asked him, after I'd been going for quite a while, why didn't he? He goes, I give you the tools, but it's up to you what you do with them. Mm-hmm. And so he really teaches that, and he doesn't, I'm not scared to come in here. I can come in here and say, you know what, it was elk season last week, and I was bad. I drank beer in elk camp almost every day, and I've been trying to knock that off. And the carbohydrates aren't good for me, but and he'd understand as much as he could, and he would say, yeah, I understand that you did that, but we got to get back on board with what we're doing. And I was never feeling like I was being browbeaten into doing something I didn't want to do. And if I had an issue and I said, this no dairy thing is really bugging me, he'd say, well, perhaps we could do a certain kind of butter, or perhaps you could do a little, we could make this up for a creamer that maybe you would enjoy that replaces the milk that you're used to in your coffee. And he's always helpful. Never did he say, oh, you're putting milk in your coffee, Tim. Mm-hmm. He's not trying to browbeat me into doing what I need to do. He's giving me the information, and he's letting me make my own mind up if that's the path I want to walk down. And if I don't want to walk down it, he understands that Tim is just a little harder to get to do what I need him to do. But browbeating is not one of his techniques. Perhaps for me, what helped a lot was we would do blood tests every few months, and seeing something, hard numbers, just for me and my psyche, the hard numbers side of it, and seeing where the ranges were and where I'm out or on the end of it, or however it looks, and which way I need to move my numbers, and how I can control different parts of my life, be it diet, be it exercise, both very important basic things that I can do. We've done some supplements which have really helped my numbers. My D vitamin level's a lot better than it's been, and there's just a lot of different things like that. I don't methylate B vitamin. I had no idea of that, so now I do a B vitamin all the time. It seems to be that I feel better than I have perhaps for a lot of years. Never thinking that I didn't feel good before. So not knowing that I wasn't 100%, and still, as I said, no one's 100%. But knowing that this is an interesting path, and it's got some really good things for me. As I go down this path, there's a lot of fruit for me to pick. So he tricks me to stay on the path.
Oh, I don't think that. I think he makes us self-accountable. I think that if you want something bad enough, you will do it. And if you want to be healthy, or you want to be healthier than you are, I think that then you will continue. And so they're all personal choices. I think that in life, some people make good choices and some people not so good choices. So I think he gives you the tools. I think that he gives you information. There's a newsletter that comes out once a month. It's on the email. It might not be specifically about something that you're dealing with, but it's just good information. I always read them. They're good. They're just food for thought. So it's just one more piece of tool that they put out there. Tim got a couple of bad tick bites earlier this year, and I guess we were coming in, and Dr. Hanes said, well, why didn't you call and ask me what you needed to do? So I feel that he's very approachable. So that it's out there, but we really need to do what we need to do. He's not gonna say, oh, what if, have you did this? He might say, did you do your exercises? To just kind of see where we're at in the process, but.
But essentially, it's up to you.
It's up to
guys.
us, yeah.
It's totally up to us.
Totally up to us.
And he has a way of reinforcing positively, not negatively.
Mhm.
And I'm really touchy, so I feel that negativity in a split second. It doesn't come out of this office. I don't get that feeling. Many times in the medical office, I came out thinking, so all they really wanted was my charge card. They didn't really help me. The standard was, oh yeah, you need to go see my, this other guy down the hall. And my thought is, yeah, he's behind on his house payment or something. It's not that he's really going to help me. I don't get that feeling in this office.
So to share anything with anybody coming in initially, I would say have an open mind. Have an open mind and really listen and really try. If it's a diet change, try it. I tend to think that the medical doctors will look at my knee, or they'll look at my arm, or they'll look at they looked at my inflammation. So they didn't look at me as a whole and say what is causing this. They just looked at the inflammation. They said, here's the anti-inflammation pill. So they didn't look at the causes. They only looked at the symptoms. So lots of times when you come in here, you're so used to somebody just looking at your knee or just looking at your inflammation that you don't really think, oh, well, why is he asking me about my feet? Or what does really my eyes have to do with anything? Or my eyes are dry. Oh, that's a sign of inflammation. Well, I don't know that. I have my inflammations right here. Why are you asking about my eyes? It just, sometimes you don't know how to connect the dots because you don't have any reference points. You've only ever been to a doctor that's only looked at that particular symptom. So I would say have an open minded and really listen and try to follow the new diet or follow, because it's all for a reason. Learn about leaky gut. Learn about what that causes and how maybe that leaky gut could cause that inflammation, which could cause your eyes to be dry. How your whole body is really more connected than what you ever really think or what we're ever really taught.
After having been to the office and looking back at it, I would tell people that you're not going to come into Dr. Hanes' office in one visit and solve your problem. If I go to the medical doctor, I expect to go in there and tell him I got a sore throat, give me some pills. Out the door I go, that's the end of it. I'm not going to go back to that doctor and there's my cure. That's not the way that functional medicine works. It took a while for me to wrap my head around it, but it can't work that way. And so I would tell people that you can't just give Dr. Hanes one visit. You need to give him a fair chance to work with you, and that's going to take a few visits, and it's a longer process than just coming in his office once or twice and, like most timber fallers, getting your back adjusted. That's not the whole program here, and at first I was expecting that, and maybe when it didn't come to be that right away, I thought for a minute, gee, is this not working for me the way I expected it to work, blah, 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 it doesn't work for me. No, I could see right away, oh, this is something I wasn't aware of, and it is an issue, and I need to address this, and the doctors tell me that's part of the root of my other problems. And so if you come to this office, have a little more patience, and you're going to be involved in this program for a while. You're not just going to come in and say, I have neuropathy in my foot, and come out of here with some supplements, and it's going to take care of the neuropathy in your foot. And it's not miracle-based work. It's scientific-based work, and that's what I like about it. And it is work. It takes a process to get through.
Typically, by the time you come to a doctor, it's taken a long time to get there. My arms didn't just happen overnight. It was a process, so it took a long time to get there, and I didn't really realize what was happening. So it takes a time. Your body has to relearn how to be back to its normal. You know, because for your body then, when my arms were frozen, that was my body's normal. So now my body has to relearn how to be back to a normal. So it doesn't happen overnight. It is a process, just like the process that it took to get you to a point where you're seeking help takes that same process to get back to where your body is normal again.
Do you have any further
No.
questions?
Thank you
Yeah, this
both
was awesome.
so much.
Like, awesome answers. This is,
Fantastic.
The only other thing I'd like to say is that, close to a year's, being under care of the doctor, I haven't had one negative experience. And I don't think I've ever been in any sort of a medical situation, be it this office or any other doctors, that I didn't come out with some kind of negative experiences from most. And so the doctor's very careful with everything down to my ego. He's really careful about every bit of it.
Doesn't bruise the little ego. And everybody in here is very nice, from Lynette to Holly. Everybody makes you feel comfortable and welcomed. The atmosphere in here is very easy. Yeah.
It still surprises me that you can remember not only my name and my wife's name, what we're doing, what we have been doing. I'm sure all the people that come in, they're kids. You have an exceptional memory, and you're really good. I always think, how did he remember? We just talked about that 2 months ago once in passing. How is he bringing that up again? He's very good with knowing what's going on with me, and it really makes me feel comfortable with I'm getting some real treatment here, because he's not just take a number and we'll take your 5 minutes and get out of here. He really cares about what's happening with me, and he really takes the time to understand. And I believe part of his success is the fact that he works 3 days a week and takes Tuesdays and Thursdays to study our cases and do the other work that's necessary to be up on and be on the cutting edge side. I mean, laser and different things haven't been around all that long. You have to somehow study that stuff, and he takes the time to study what needs study, but a lot of that study is my particular case, and I feel like he's really given it the effort that it deserves.